One of the qualities that really sucks the most about back labor is that you experience pain even when the contraction is over. So this is the reason that I think it can be so excruciating. And unfortunately, we don't know. We can't predict if we're going to have back labor when we go into labor. But I also think that doesn't mean that you shouldn't prepare for it. So I want to share some tips and strategies for dealing with back pain, back labor, so that you won't be left scrambling without any options if you do experience it. But first, probably we should back up a little bit and talk about the reasons why back labor happens, kind of what's going inside of our body. And for that, I need to grab a couple props. I'll be right back. Okay, so I've got my fetus and my pelvis here to show you that back pain, back labor, it's usually caused when baby is in a particular position. And this position is called occiput posterior. Also could be referred to as sunny side up, you might hear that. And that's when baby is actually entering or traveling through our pelvis with the back of their head up against our spine. So here is where our baby is going to travel through the pelvis. This is our spine. And when our baby is in this OP or occiput posterior position, we have that situation, which is like bone on bone. And that is why a lot of people describe back labor as a shooting pain, a grinding pain, and it has to do with the way that those bones are lined up together. So alternatively, the baby can enter the pelvis looking to the side or can enter looking to the back. So if baby is in that position, we might experience back labor. Another reason that back labor can happen is if our uterus is in a position that is often called either tilted or tipped. So if your healthcare provider has mentioned that you have a tilted uterus or a tipped uterus, that means that your uterus is pushed a little bit tilted towards your back. And in that case, your baby might not be in that OP position, but you still might experience some back labor because of just the way your anatomy works. I know that was the case with my birth, where my mom said that she has a tipped uterus and she never knew that's why she had back labor. Of course, back then they didn't really share much information and childbirth education wasn't super available like we have here on YouTube. So now we have some insight into the cause. Let's tackle our tips and our strategies for dealing with back labor. So we can, number one, we can deal with it by reducing the pain. And then the second thing we can do is try to fix it. So we can fix it by trying to make it go away, fixing the situation that's causing the back labor. First, 5 ways to reduce back labor pain. Number 1, which is I think one of the easiest, and that's to use heat. So you can do this with a heating pad, you can put it right on your lower back, or really my favorite is to get into a shower and point your shower spray, that direct heat, right onto your back, the hottest water as you can. And if you have the ability to do this shower method, I mean, it's really the one that I love. And I like to set up my clients in a darkened bathroom, just like a little tea lights and probably a Bluetooth speaker with their Spotify playlist, their partner in there, and have that stream of water right on their back and can help really soothe the back labor. The second method to reduce pain is using a TENS machine. You might hear it called a TENS unit. So this is a tool that you would need to have on hand for labor. It's a handheld device. Actually, I have my doula bag here. I keep it in my bag for my clients, but it's something that you can purchase on your own. It's a small electrical device, battery operated. This one is actually from the UK, but I'm gonna put a link, product link to one that you can get here in the US. So it's about this big and it has wires and 4 electrodes. The device delivers small electrical pulses to the electrodes, and most people put them right on their back in a 4 kind of square pattern. So TENS machines have become really affordable. They're right around $40. Like I said, I'll have a link below. So you can consider investing in one as a bit of a safety net for labor. And if you have one of these and you experience back pain, you would put the electrodes on, adjust the settings kind of back and forth to provide some pain management. I want to do a quick shout out and thanks to Manisha6814 for her question that she left in a comment asking me to talk more about back labor. So if you also have a question that you'd like for me to address in a video, drop me a comment. And if you like learning about labor and birth, go ahead and hit that subscribe button. So the next method for reducing pain is the double hip squeeze. So this is where your partner or your doula will place their hands on your back, really at the top of your pelvis. Where's my pelvis? Right about here. And they're going to squeeze during the contraction. Now this is a great technique and it can really help with the pain, but it can quickly exhaust the person that's performing the hip squeeze. So it's really not sustainable over a long period of time. So it might be something that you can alternate with maybe the heat method. So spend some time in the shower, spend some time with the double hip squeeze. Now, number 4 is called sterile water injection. Now, this can be a very effective technique, but it's really unfortunate that very few doctors and midwives are trained on how to perform it. Actually, in the over 300 births that I've supported, I've only had one client use it, but it was super effective. So if you are getting your care from midwives, then you might ask in a prenatal appointment if they can do it. But if you're with OBs, the chance that that's available to you is probably pretty slim. It involves putting sterile water, just a little amount under your skin in 4 places on your lower back. And this process of getting in these little bits of water, it can be very painful, but once it's in, it can really form this kind of magical relief from back labor. So maybe it's an option to you. And then the 5th option for managing pain of back labor are the classic pain strategies that we have available, like epidurals and possibly nitrous oxide. And those can also help manage the pain of back labor. Okay, so let's talk about how to fix back labor or stop back labor. You can try encouraging a rotation of the baby. So if it's the case that the baby is in that position, that OP position, and that's causing the back labor, rotating the baby might be the answer. But it can be complicated. So really the first thing I would do is ask your nurse, or if you have a doula, if they have any tips or ideas on helping your baby rotate because you're having back labor. It's really hard for you to remember sort of all the complex tips, but if you have a nurse that can do it, then that's awesome. If you don't have a nurse that can help or just generally want to work on it yourself, get into an asymmetric position. So one of my favorites is like putting one leg up in a chair or on a stool. This is sometimes called the Captain Morgan position because it's like the captain on the rum. You don't really have to choose like if you're going to manage pain or if you're going to try to rotate the baby. You can actually put those together. And a scenario might be something like get into that shower, like I mentioned before, and get that heat on your back. And then while you're in the shower, try to get yourself into that asymmetrical standing position. So maybe you have one foot on the side of the bathtub. Safety first, of course. If you're feeling unsafe, don't do that. But if you have the ability to bring in a metal stool or some type of chair that can get wet and you're in a large shower stall, that can be another option too, where you are trying to get the best of both worlds, both taking care of the pain and trying to rotate the baby. You could also do an asymmetric kneel on the hospital bed, and your partner at the same time could maybe hold a heating pad to your back. So managing the pain and trying to get baby to turn. If you aren't very familiar with asymmetrical positions or you'd like to know more about them, know some more options, they are really amazing because they can help labor progress. This video right here shows you all sorts of asymmetric positions. I think it's a great one to watch next. And thanks so much for joining me today, and I will see you next time. Bye.